The work of an embryologist begins with the puncture of ovarian follicles at the moment when test tubes containing follicular fluid are handed over from the operating room. This fluid contains oocyte, which the embryologist identifies under a microscope and assesses for preliminary quality based on the appearance and structure of the cumulus cells surrounding each oocyte. After a brief period of incubation, the process of denudation follows. This involves the gentle mechanical removal of cumulus cells using an enzyme that loosens the cells within seconds. This allows for an accurate assessment of the maturity and quality of the oocytes. Only mature oocytes possess the full potential for successful fertilization. At the same time, the Andrology laboratory processes the ejaculate and prepares sperm for in vitro fertilization. Our laboratory offers a wide range of separation methods, from basic centrifugation techniques to modern approaches that additionally allow for the targeted elimination of sperm with fragmented DNA. The fundamental method of sperm processing is the swim-up technique, which is based on the active migration of motile sperm into the culture medium, and density gradient centrifugation, in which viable sperm are separated from seminal plasma or from residual testicular tissue following surgical sperm retrieval by means of a density gradient. Modern approaches include the MAX method, in which magnetic microparticles specifically bind to sperm exhibiting signs of apoptosis. The labeled sperm are then retained as they pass through a specialized column within a magnetic field, while viable, high-quality sperm pass freely through the column. The most advanced and increasingly favored method in andrology is microfluidic sperm separation, MSS, which is performed in a specialized chip equipped with a microporous membrane. The passage of sperm through the chip mimics their natural journey through the female reproductive tract, resulting in the physiological separation of genetically and morphologically competent motile sperm from those of poorer quality, without the need for centrifugation. In cooperation with the laboratory, physicians always select the optimal procedure to obtain sperm with the highest fertilization potential, taking into account the patient's semen analysis parameters. The processed sperm are then handed over to the embryologists, who use them at the appropriate time to fertilize the oocytes. The preferred fertilization technique is intracytoplasmic sperm injection, ICSI, which represents a highly effective method even in cases of severe male infertility, while also overcoming certain immunological barriers between the sperm and oocyte and minimizing the risk of polyspermy. Incubators are an essential part of every embryology laboratory, providing a controlled and stable environment in which embryos are cultured from fertilization through to transfer or cryopreservation. Our laboratory is equipped with state-of-the-art benchtop incubators that allow for separate culture of embryos for each treated couple, ensuring maximum safety as well as rapid recovery of culture conditions after the insertion of a culture dish. We also use a time-lapse incubator, a revolutionary technology that enables continuous monitoring of embryo development through an integrated camera. This eliminates the need to remove embryos from the incubator and expose them to fluctuations in temperature or pH. The advantage lies in detailed tracking of development dynamics, which allows us to select those embryos with the highest potential for implantation and healthy development. Another component of laboratory care is assisted hatching, which involves the targeted disruption of the embryo zona pellucida using a laser. This precisely controlled procedure supports further embryo development and facilitates its implantation in the uterus. In addition, it enables the safe collection of cells for pre-implantation genetic testing. Our laboratory routinely performs extended embryo culture to day 5 or 6 of development. During the first 3 days, embryo development is governed solely by maternal genetic information. However, from day 4 onward, control is gradually taken over by the embryonic genome. Only an embryo that is capable of developing to the blastocyst stage demonstrates true developmental competence and a high implantation potential. The blastocyst also represents the ideal stage for pre-implantation genetic testing and for cryopreservation, as its cells are significantly more tolerant of the freezing and thawing process. On day 5 of culture, high-quality blastocysts can be managed in the following ways. The first option is embryo transfer, during which the embryologist draws the best quality embryo into a thin catheter, hands it over to the physician in the operating room, and the physician then transfers it into the patient's uterus under ultrasound guidance. The second option is embryo biopsy for implantation genetic testing. The biopsy is performed on embryos at the hatching blastocyst stage, when 5 to 10 trophectoderm cells, destined to form the embryonic membranes rather than the fetus itself, are gently removed using a micropipette and laser. This procedure does not negatively affect further embryo development. The collected material is transferred into a microtube and undergoes thorough genetic analysis in the genetics laboratory, depending on the selected type of testing. At ReproGenesis, we offer a range of genetic testing options for embryos, including the standard PGT-A method, which detects chromosomal aneuploidies. For a more comprehensive assessment, we provide the PGT-A+ method, which not only identifies chromosomal abnormalities, but also determines whether they originated from the oocyte or the sperm, and whether the error arose during gamete maturation or later in the course of embryonic development. Another method is PGT-SR, which is used to detect structural chromosomal abnormalities that the embryo may have inherited from one of the parents. The most comprehensive method, PGT-M, is used for the diagnosis of monogenic disorders. It enables the detection of specific gene mutations and provides couples at risk of transmitting a monogenic disease with the opportunity to conceive a healthy child. PGT, therefore, significantly increases the success of infertility treatment, shortens the time needed to achieve pregnancy, and markedly reduces the risk of miscarriage or the birth of a child with genetic disorder. The final procedure performed in the embryology laboratory is the cryopreservation of embryos, both those that have undergone biopsy and all surplus high-quality embryos. These frozen embryos can subsequently be transferred in one of the patient's later cycles as part of a so-called frozen embryo transfer, eliminating the need for repeated ovarian stimulation and egg retrieval. The cryopreservation of embryos, as well as oocytes, is performed using the modern vitrification method, an ultra-rapid freezing technique that minimizes the formation of ice crystals and thus provides maximum protection of cellular structures. As a result, the high quality and viability of the embryos are preserved for future use. Our clinic also offers social freezing, the preventive cryopreservation of oocytes for women who wish to safeguard their reproductive potential for the future. From the moment of follicular puncture through embryo transfer or cryopreservation, every step in our laboratory is supported by cutting-edge technologies designed to maximize the likelihood of a successful pregnancy. For gynecologists, this provides confidence that their patients are receiving the highest standard of care available.